I'm Randy Alvarez. Today's topic, how to improve your health naturally. With us, we have an expert on the topic, Dr. Dirk Cansilia. Dr. Cansilia, welcome to the program.
Hi, Randy. Nice to be here.
Now, before we get into today's topic, and I said you're an expert on the topic.
Correct.
And, in all my shows, I try not to endorse the doctors, and truly this is not an endorsement, but you're one of these guys, like you said, you've been studying this for about 30 years.
About 30 years, yeah. I started out in high school just reading nutrition books and was participating in athletics and just kind of grew from there. Went into college, played football at the University of Colorado.
Were you any good there?
Pretty good, yeah. A couple of injuries, but I worked through it, and I loved football and I loved the sport. But I got into weightlifting because of those two injuries, actually, into rehabilitation mode more.
Yeah, and that suit you can't tell, but you are really a fit guy.
I love to work out, and I try to practice what I preach, definitely. It makes it better for patients, of course.
One of the things that I also like about you, we're talking in the green room over there, and you say that I don't think with chiropractic that it's the cure-all to everything.
No.
Expand on that.
Absolutely not. Well, it's great.
Because I meet chiropractors like that, and I don't, I don't know.
Right. Well, it's great for certain conditions, and for some conditions, it's just not really effective. I mean, there's a place for traditional medicine. There's a place for alternative health care. Okay. There's no doubt. Not one thing just encompasses every patient. It just doesn't work that way.
But you say you don't want to keep them going there forever as well.
I don't like patients treating forever. I mean, I don't think that's a sign of a good doctor. I think what you need to do is set out goals, the patient and the doctor combined, get a treatment plan organized, find out if you meet those goals, and then maybe periodic checkups or rechecks depending on what you have going on. But the key is make sure the patient, on the type of treatment we do with chiropractic and alternative health care and blood-based nutrition, is they can monitor themselves and they can kind of continue on themselves.
All right, now you're in Rancho Bernardo.
Correct.
And you have two centers in one place.
Correct. We have different types of patients that come to us. Sometimes it's patients that just have a back problem, and maybe it's an auto accident they had or a sports injury.
And you take insurance for those kind of things?
Of course,
okay.
Of course. And they just want to get treated for that condition, so we treat them for that, and they kind of go on their way. But there's a big part of our practice that comes out from patients that want more. These are executives, these are head of households, these are people that have to be on top of their game. These are moms that are juggling 3 and 4 kids and running the husband's life and career. Okay. So we have to keep them sharp. And so that's the type of patient we see coming to us looking for alternative measures.
Okay. So let's begin then with your typical patient that wants that alternative health. Take me through that process.
I think it's predominantly more women than men.
Okay.
It's probably between the ages of 30 and 55 years of age. It's somebody who characteristically, there's a lot of fatigue, there's a lot of insomnia. They just don't feel right, and they want to feel better, and they come to us with a whole variety of situations or symptoms that are occurring.
So with these people, by the way, backing up for a second, you say they come to you, they want to feel better.